Here's an important tip when choosing a Medicare Part D prescription drug plan to keep your costs down. Whether you're doing the enrollment on your own or you're working with an agent like myself, you're going to want to have the name of the drug, the dosage, the frequency, is it a capsule, is it a tablet, etc. Once you have all that information, you're going to either put it into Medicare.gov or I do it into a proprietary software. And what happens is the software helps us determine which is going to be your most cost-effective plan. When you're looking at which is going to be the most cost-effective plan, don't just look at one factor. Don't just look at the premium or the deductible. Look at the overall, what is your cost expected to be for the entire year? So for example, you could have a plan with a $0 premium, but the drugs at the pharmacy are going to cost you $2,000. You could be in another plan with a $50 premium, and maybe the drugs only cost you $700. So you look at that, you compare the different plans. But here's the important tip that I want you to remember. So when you're enrolling in the plan, you're basically basing it on a snapshot of you of that day, the medications that you are on. But what happens if you end up 3 months into being on the plan that you add a new medication? How do you keep the costs down? Sometimes you're just stuck with an expensive medication. There's not much you can do about it. But for a lot of you, with each drug plan, they have what's called a formulary. And each drug plan is going to be a little bit different. And a formulary is a fancy word for a drug list. And within that drug list, the companies are going to have different drugs with different tiers. Typically, the lower the tier, the less expensive the medication is. For example, let's say you are diagnosed with diabetes, and now your doctor is trying to determine which medication to prescribe. So if you provide the formulary to your doctor can look to see at the different possibilities, what's going to be cost effective. So for example, here it says metformin, and you can see that it's a tier 1 drug. So your doctor can use this as a resource in picking out a new medication. And then the good news is, in the fall, if you can't find a cost-effective medication under your plan, you can always choose what's obviously going to be the best for your health and then switch drug companies, drug plans for the next calendar year. That's why you do your annual review.